I'm now joined by Project Coordinator at the Population Council, Julialynne Walker. The Council's research focuses on HIV/AIDS, reproductive health, youth, as well as gender. Ms. Walker, good morning. Welcome to Morning News today.
Good morning.
Your organisation focuses on many of the things on which First Lady Michelle Obama will be addressing on her visit to Africa. How important is her visit, and how important is it for her to be tackling these issues in terms of the work that you guys are doing?
Well, thank you. I think that her visit is important from the Population Council's perspective because it looks holistically at the issues affecting youth today, particularly young women. And she's able to bring a dynamic to the discussion, a particular focus, because she's saying, let's look at young women in terms of what they can add to the economy, what they can add in terms of education, and what we can do to support them to ensure that in the future they can contribute as productively as possible. In terms of the Council's research, right now, for instance, we're giving strategic guidance to post-rape care in 6 of the 9 provinces, soon to be the 9th province. And we found that, unfortunately, youth account for almost 40% of the rape cases in South Africa, at least in the areas we've been looking at. So we're saying it's really important to understand the vulnerability of young people, particularly young girls, and look at what we can do to support them going forward.
Now, HIV is a huge social problem, and it has many facets to it, and requires, I guess, a very robust social development department for it to be able to tackle. You need social workers, you need nurses, you need counsellors, and there's so many facets to it in terms of trying to deal with the pandemic. Where do we begin?
All right. It's very interesting the way you've couched the question, because there are medical issues and then there are what we call the socioeconomic issues. And we understand that it's not enough just to deal with treatment. We have to look at a whole spectrum of care issues. And we look at a number of those in terms of what we call psychosocial support. And we look at the way in which children can be reintegrated, because one of the mantras has been, it's important to live positively. You know, being infected is not an automatic death sentence, but in order for that to be true, we have to build institutional support for children as they move forward. One of the things that's coming up right now is this question of pediatric disclosure. We're noticing that children who have been infected at an early age are now in their preteens, their early teens, and so they're dealing with questions around their sexuality that as a society we haven't really dealt with, we haven't addressed before. And so we're saying that it's important that we build a support structure that allows for the caregiver to be able to encourage the child to know their status and why they were infected, and then how to go forward positively, how to have a full life without, without being able to have a full life.
What should Ms. Obama be saying to the youth? If you were helping her write her speech, what is the one thing that you believe she should be saying, or the sort of noise that she should be making when she speaks to the youth of not only South Africa, but the rest of the other African countries she's visiting?
Actually, very simply, I think she should just look at herself and her own life. And I think there are 3 things about Michelle Obama that are really important for anyone to know, but particularly youth. One is a question of discipline. She's an extremely disciplined person in terms of her personal care, in terms of her mental development, and in terms of how she deals with a number of the contradictions that have emerged since her husband's become president. She's been very focused. She's identified her key issues, and she has understood that regardless of the storm in the teacup that sometimes comes up, she stays focused on them. So this question of child health and obesity, and the fact that she's planted a garden in the White House lawn, a vegetable garden, and despite people saying that you should stay out of the family's business and child health is a question of the parents for the deal with and not for society to deal with, and she says no. Childhood obesity is a question for all of us because we need, healthy citizens in the future. And then she has looked at, what can we do to achieve social change? And I think that that's a very important question, because right now in South Africa we have people who may be focused, who may be disciplined, but it's on very selfish concerns for themselves as opposed to looking at what they can do for society as a whole.
Thank you very much. It's been an absolute pleasure having you with us. That was Population Council's Julialynne Walker.